Namaskar. This is Manjusha Kelkar from Breakthrough Higher Education. Good, better, best, never let it rest until good becomes better and better becomes best. That is, friends, my tagline for Breakthrough Higher Education because we always try for the best. And if you are good, then become better version of yourself. Don't compete. And if you are better, then become the best version of yourself. Because competing with yourself is the only key to success. That's what we believe at Breakthrough Higher Education. So, welcome again. Why am I here today is because of a special career which was in demand, and for my past 21 video series, there was a good response and a demand from people about this particular career, which is called as occupational therapy. Now, as we are talking majorly, I have covered, I think, 5 or 6 days for career in medicine, different aspects of medicine. So, this was in again a popular demand that what exactly is occupational therapy and how to do career in it. So, first, the career part. In career part, this is a BSc degree. It's a 4 years degree in India and as well in US. So in India, if you are going for BSc Occupational Therapy, that's the name of the degree. Many good institutes and medical colleges especially have this degree. When we say BSc, then we think that whether it will be where it will be available, in which type of colleges it will be available. So it is available in medical colleges as well as other colleges. That means it is available with medical college setting also, whereby you come to understand the patient needs and accordingly you treat. Now, coming back to the original question of what is occupational therapy. When I talk about what is occupational therapy, then I have talked to many seniors in the field. And what they have told me is that occupational therapists focus on fine motor skills. Now, when we talk about fine motor skills, usually, and one more person told me a definition that everything to do upper part of the body is occupational therapy. So we are talking about fine motor skills, and this fine motor skills can be true with any and all the age group of patients. Sometimes people feel that it is only related to rehabilitation or something like that, but it is not so. It's not the only thing where occupational therapy is used. So this is roughly the idea. And in India, previously we used to have 3 years of BSc degree, but nowadays almost all the colleges, including AIMS, have got 4 years BSc occupational therapy degree in place, and out of that the last 6 months is compulsory internship, whereby you go into the clinical setting. You treat the patient actually because you are an intern now, and you take the case study, you prepare the what these people call as the uh, remedial measures which are to be taken for this particular patient. So sometimes people do share me with instances whereby an elderly lady was immobile. So the occupational therapist thought of, okay, what her hobbies would be, or what would she love doing the most, so that she will get a sense of, okay, I have achieved something. So she gave her a task of kneading the flour, and she was so happy. She said that for past 10 years I have not done that. So that is what exactly I mean by using your fine motor skills. One of my acquaintances also explained me that look, we have to keep on doing that rangoli thing as we age, because that also develops or keeps our fine motor skills in place. So that's the basic understanding or the meaning of occupational therapy, which uses movement of small muscles of the body. The large muscles of the body usually not used, but the small muscles of the body is used. Now, going back to the career scope. Now, career scope or career advancement after your graduation, you can as well go for post graduation, that is masters in occupational therapy. You can go for your PhD. You can do ample of things with your occupational therapy degree. And it in which settings do you work? That's the basic question asked to me many a times. And the settings in which you work is hospitals, private clinics, health centers, rehabilitation centers, of course, yes, and different types of NGOs, whereby you do your work and you progress in your career path. After doing your graduation, also, you can start working. After doing masters also, yes, you get a career jump and your career path is drawn. After that, if yes, somebody is really interested in academics, they can as well go for PhD. That is roughly the track for an occupational therapist. Now, one question, I think I will refer to the question, what is the, in short, the curriculum structure? Okay, one more interesting thing people have asked me, what subjects do people study here? In occupational therapy, people study which type of subjects? So let me brief. Again, I talked to one of the seniors who is there in this field. That is, she's an occupational therapist. Then I get to know and I understood. I visited, and I then came to know that okay, these people are studying all the science subjects. That is, for example, physiology, biochemistry, microbiology, public health, ergonomics, bioengineering. And why are all these required? Because you are dealing with the fine motor skills. So all these things are required. They are an integral part of your syllabus. Then always, yes, you are a sort of allied medical field. This is an allied medical field whereby you are helping out to the main physician for the fast recovery of the patient with whatever disease he or she is suffering. So pathology you must understand, you must understand microbiology. Then as a allied science, yoga is also taught to you. Biostatistics, because if you are into research, then biostatistics is also taught to you. One interesting thing I noted, that what psychologists you call as NLP, that is neuro linguistic programming, this is also taught to them, because it is one of the portions whereby you can understand the person better so that you treat him better. Because and these people are into very close alignment with the patient, because they are working with them, actually working with them. So this is very important part which I understood about occupational therapy. And thinking about the scope, yes, it is going to rise definitely, because in India also we are growing with the older population, and therefore for rehabilitation etc, plus when old people are not able to move some parts of their body, then what exactly is occupation? Occupation means the thing which you had been doing in your life. So that is occupation. Maybe it work, maybe it daily work. For example, a simple thing like combing your hair, it will also require some teaching as you grow old. It will require some teaching with special need children. So all these areas are covered in this course, and this occupational therapy course. So you have to do a lot of field work there, and some behavioral interventions also have to be coming in place when you are treating them, when you are trying to solve their small problems. So that the basic intention is to somehow make it sure that they live on their own. They don't take help of other people for small thing of theirs, their day-to-day activity, their daily activity. That is the intention of occupational therapy. And related to that, yes, tomorrow morning 11 p.m. I'm going to interview a renowned personality who is practicing in USA, Rashmi Rajadhyaksh. So do visit the same place where today I'm going live, so that you can hear how it goes about, or what it is like to work as an occupational therapist and all other fields in USA related to the same specialty. So yes, tomorrow morning 11 a.m. IST, I'll be going live with her. Now, talking about US system of education in case of occupational therapy. Some years back, with the bachelor's, you could go and practice in USA. It was recognized, and but nowadays, masters is, you have to, maximum of people are doing this, that they are doing their bachelor's here and then they are going for their masters in USA. That is masters in occupational therapy. Very good colleges are available there, and the rough course structure would be like it will span for say 6 semesters. Out of that, 4 semesters will be theory and 2 semesters will be your clinical, that is 24 weeks of clinical. And usually it is having 76 credit hours for this complete course. It's a full-time course. And you go for your masters, you have to appear for your TOEFL exam. And many new things are coming up in this area because this is a research field. Daily we want human beings to live a healthier, longer and satisfying life. And therefore this particular area is fast coming up. The career scope is huge. In case of Indian context, coming back to Indian context, for bachelor's, you should be having your 50% in PCB, and some universities, some good universities will conduct their own entrance exams. So you have to appear for them either, or they'll take you on the basis of 12th standard percentage. So either one of them will be good enough, and depending upon university to university, because like NEET, it is not a centralized admission process. Every university, every state has got its own status quo, by which type they would like to attend this particular or take particular students. So this we have to understand and then move forward. So that was all about occupational therapy as a career. But yes, do come and visit the interview, because she's a famous personality. She has got tremendous insights into the Indian education system as well as the USA educational system and practicing of occupational therapy. We would understand with her today what it is to be like being a registered occupational therapist and a licensure occupational therapist. Do we have to give any exams, and how it goes about with occupational therapy in USA as a career? Thank you. Namaskar. So meet you tomorrow morning at 11 a.m.